A hernia is basically a bulge, protrusion that develops in the abdominal wall. The abdominal wall is the muscle layer in our core, and there are some natural weak spots that we have, and those can enlarge over time, or other locations where you may have had surgery before can develop, and you can have a hernia develop there. Hernia symptoms that you may experience can be a dull pain, a sharp pain. It can even cause what we call an incarceration or strangulation, where the intestine can get caught up in that defect. And when that happens, that can cause an emergency that we have to repair urgently. A lot of times hernias are just kind of uncomfortable, and they cause issues where it can affect your day-to-day activities, your daily living, to where it's time to get something done to address that. And that's what we're here for. Over time, all of our tissue just kind of weakens and stretches out. So naturally, hernias can develop. Sometimes it can be due to things such as pregnancy, where the abdominal wall stretches quickly. Sometimes it can be something from coughing or sneezing or heavy lifting quickly. Sometimes you've had surgery before, you've got a weakness where you've had a previous incision and that can open up. And so there's a lot of ways that hernias can develop. Hernias really may not be able to be prevented, but there are some risk factors that you may have. Some patients, for example, may be smokers, and they've had a lot of coughing over the years, and that smoking does affect your tissue over time. Obesity is a common problem in today's society too, and obesity is probably the main risk factor that we have for developing hernias. That increases our abdominal pressure, which adds to more pressure that can develop these hernias. Not all hernias have to have surgery. Sometimes they don't cause any problems. You have no pain, they're not getting larger, and you feel like you can live with it, and that's okay. But there still is that risk that the intestine can't get caught up in that, but it can vary with the size of the hernia, the location of the hernia. But if a hernia is causing pain, if it's affecting what you're doing day to day, then it's not likely going to get any better. The natural course of a hernia is it's going to get larger, it's going to cause more problems, and at some point in your life, you're likely going to want to have surgery to have that fixed. Warning signs that you might want to look out for if you have a hernia that could be causing an urgent or emergent problem. If you have changing in color to the hernia, if you have increasing pain, if you start developing nausea and vomiting. But on average, you're going to know that something's really wrong if you need to have something done emergently.